we want to look at healthcare data security. We want to know what are the threats that can happen to health data that we have collected. So what measures can we put in place to make sure that these threats can be prevented? Okay, and then we look at the role of the healthcare providers in ensuring that they really protect patient data. So that will be our focus for discussion. Okay. In a hospital setting or in any healthcare organization, a lot of data is collected. Often it is easy to think that the data that is being collected is only data that is about the patient in terms of their demographic data and the medical history, the medications they are taking, and things like that. The healthcare data goes beyond that. Okay, so we have elements of data that comes into our possession because of surveys, because of suggestion box, the information that we collect from our suggestion box or boxes, and then we have information that comes to us because of diagnostic tests. We have information that comes to us because of the digital health devices that we give to patients. So for example, we give a patient a device that can monitor their heart rate. That information still comes back to us. So you can really see that we have a lot of data in healthcare organizations, whether it is a tertiary hospital, whether it is a secondary hospital, whether it is an outpatient clinic, whether it is a research organization. There is always a lot of data. This data should be kept securely, such that there are no security risks, such that this data is not accessed by people who do not have the appropriate authorization. Okay, so we want to look at what are the things that we can put in place to ensure that this data is kept confidential and is not accessed by different unauthorized people or parties. Okay, so that is the purpose of this presentation. Okay. My slides want to misbehave, but I'll find the way out. So data privacy is very important. When I go to a hospital and I'm treated, I don't want my medical records to be accessed by other individuals. This information is sensitive, and it has if it is accessed by other people, there are a lot of negative effects or negative consequences that can really happen. Okay, you don't want people to know your medical condition. You don't want people to know the medications that you're taking. So this information is very sensitive, so you don't want it to go out. Okay, so when there is a data breach, that this is to say that when people who are not supposed to access your data access it, then you're going to have repercussions as healthcare has an organization that provides health. Okay, so it means that it is their responsibility to ensure that this data is actually kept safely. If it lands into the hands of attackers, hackers, then the organization will most likely suffer legal repercussions. Okay, so in the process of providing care, patients should consent to the fact that their data will be collected. Okay, and they also need to know how this data will be used. And we will see that it is very important not to collect every irrelevant data that you're not going to use. We talked about this yesterday. Relevance, data relevance, that the data that you collect should be that data that it should be used to improve the patient's outcome. Okay, so you don't want to collect data that is not necessary. It's part of being ethical in data management. And then be transparent about data management procedures, especially an issue to do with data sharing. When you collect this data from the patients who are your clients, they should really know how you share this data with other entities, if any. Okay, you don't want to be an organization that gives out this information to third parties without the clients knowing. Okay, so these are situations where, for example, you pick clients' telephone numbers and then you give these telephone numbers to other people, maybe for marketing purposes. So from nowhere, your client will see message coming to their phone, and they did not actually give you their phone number. Okay, so you go to a hospital which has all these numbers, you get these numbers, and then you share these you share messages via this number. So the patient will ask themselves, where did this company get my number? Okay, yet I've never reported that company. So one of the issues could be that this number was actually gotten from where you had gone to get health care. And if these people are not very strict with data management, it means they can easily share this information with they can share this information with the other third parties, sometimes for monetary benefit. Okay, so you don't want to be in such a situation. So unfortunately, in our country, we have not gone further to look at data regulation and then incorporate data regulation guidelines or practices in our laws. Okay, so hospitals here or health facilities, whether private or government owned, there is no data protection law has been passed by the government to regularize how patient data is supposed to be kept securely, and if it is to be shared, how is it supposed to be shared? Okay, so as a country we are supposed to have these data protection laws, or you can call them data privacy laws. Okay, we need to have them in place such that the hospitals, the proprietors and the health workers know the implications of mishandling patient data. There should be penalties for sharing data when the patient has not given you the authorization. Okay, so the challenge that we have is that we have countries that are really advanced in this area, where data protection is actually enshrined in the constitution as an act of parliament, and other countries like ours, we are yet to move in that direction. So we have inconsistencies in regards to data privacy regulations. Okay, so you find out that different countries have their own regulations, and the extent to which these regulations actually have to evolve with the technology is also very important. We shall look at the technologies that are being employed in data protection. So you cannot have a data protection law that was enacted in 2000 or even 2011, because during that time application of issues to do with let us say machine learning, block technology, AI had not come into force. Okay, so even the regulations themselves need to they need to evolve with the technology that we have. Okay, so that is very key. But the other issue that policymakers have to think about is about the delicate balance between wanting to maintain this privacy and also balancing it with innovation and research. Okay, because research can be done through this data that is being collected from the patients. Okay, but at the same time you don't want this data to be accessed in a way that is not transparent, in a way that is not authorized. Okay, so that means that you have a decision to make whether you want people to access this data such that they can use it to innovate, to do more research and come up with better ways of protecting this data, or you're going to say, no, I'm not going to give you access to this data because of privacy issues. And when you do that, it means that you're limiting people from accessing this data for research and innovation purposes. So that is the balance that you have to be aware about. So in this presentation, we are going to look at the different healthcare data management systems, because if you talk about healthcare data security, you need to understand the technologies that are being used to store this data, storing it, processing it, and also sharing it. You need to know these technologies, and then that is when you'll be able to know the different threats that can happen in the different technologies. So the first data storage system we are going to talk about is what we call cloud computing, where we basically contract other people to store our data. That is what we call cloud computing. So patient information is being kept by another person. We are basically almost like doing what we call renting. We are renting space to keep our data with another person. That's, in a simple language, that is what we call cloud healthcare data management or data storage. Okay, so in such situations, all these medical information about patients is stored through these cloud computing providers. Okay, there are patient identifiers, patient demographic data, diagnoses, prescriptions, and a lot of things. It could be even in the area of research, clinical data, genomic data, and a lot of things. Okay, so that's about cloud healthcare data. The advantage with that is that, of course, you can store enormous amount of data. So whether the organization grows in capacity, you can still keep that data. So there is that element of scalability, which is that you can adjust. Cloud computing allows you to adjust seamlessly, okay, whether you're scaling up or even scaling down. Okay, you get a product that will match your needs. Okay, so if you want to have, if you want to store more data, it's very easy to do that. If you want to limit the data that you're storing, you can also do that. Okay, so that's one advantage of cloud storage. And then flexibility. This is to say that, for example, cloud computing, the simple applications that we know that use this technology, what we call Google Drive. Okay, Google Drive is basically that. What we call as Dropbox is also a computer cloud computing application. Okay, Dropbox is the same thing. So with all these examples that I've given, as long as you have the logins to them, you can access your data on any device anywhere, as long as you're connected to the internet. So it's the same thing with the cloud computing for healthcare data. You can access this data anywhere you are, as long as you're connected to the internet. And then, of course, buying this space or buying this cloud storage space is cost effective, because you're basically sharing. If you're sharing, the cost is distributed amongst the users, so everyone is you're able to buy space from one provider. You have many users paying for this cloud computing storage. So that means that in the long run, it's basically cost effective. So the challenge, as with all the other systems that we shall look at, is that you have problems with the data being accessed illegally or unethically by hackers, or someone sending a malware, or someone who is careless, making a human mistake and then making it very easy to access this data on the cloud. Okay, and then also you also need to realize that the cloud storage providers, the people who sell this space that you're putting your data, also have employees that may have access to this data. Okay, there is no way they will store this data. The cloud computing providers cannot keep this data without having the security measures to make sure that they can access it if it is actually need. So there is that possibility that they can access this data. It's just like someone renting your house. I mean, you're renting someone's house and that person has a spare key. Okay, he's the owner of the house, and for you are also renting that house, and you have a key, and he also has a duplicate key. So meaning that if he actually wants to enter your room, he can do that. So there is a possibility that cloud service providers can actually access information, okay, even their employees. Okay, and then the other issue is that the extent to which you can share this data can be affected by policies. Okay, so what basically happens is that you enter into an agreement with these cloud service providers. So this agreement should have policies that detail how this data can be accessed or even shared. Okay, so there are situations where you don't have adequate policies on sharing this information on the cloud. And then if you live in a country, for example ours here, where we have less developed ICT infrastructure, most likely you have to get cloud service providers outside the country. Okay, so that the challenge with that is that the laws of that country are not the same laws as in where we are. Okay, so you have challenges there. Like I earlier on stated, that South Sudan is lacking updated laws on data privacy or data protection laws. Okay, so if you want to store your data properly, you may have to get a provider who is outside the country, and where the laws for protecting data are very strict, because these cloud service providers also have to work within the laws of their country. And if we have data issues, they can be penalized by the authorities of their government. Okay, so that's an issue that you have to balance on where you can get cloud service providers. So how do you protect your data in the cloud? Of course, you need to get a credible cloud service provider. You have to do the due diligence. You need to get reputable organizations that have been doing this for over and over, and they have very good reviews. You don't want to surrender your data to providers that are not reputable. Okay, that's very, very important. And if you enter into a contract with them, then that means that the policies, the clauses in that contract need to be clear and adequate to limit the extent of access and sharing of this data. Okay, but technically you need to make sure that one, the data is encrypted so for example, if your data is here and you need to transfer that data to servers, cloud servers that are in another country, then it means that that data throughout from the transmission, okay, the transmission from your servers to the cloud servers, that data has to be encrypted. Encryption is where you have the data in a format that is unreadable. Okay, that is encryption. Decryption is when you are turning the data that is unreadable into readable format. So if you don't transmit this data in a format that is non-readable, then it can be intercepted and then accessed. You don't want that to happen. And then you need to implement strong access controls to restrict access only to those people who are authorized to access this data. Regularly do data checks or data audits to check if there are areas of weakness, which we are calling here vulnerabilities, that potential hackers can use to penetrate into your data. Okay, so do those regular audits to check. Okay, and then if the cloud service providers are not in your country, then you can look for options where they can really provide you the services within the country that you're operating in, what we are referring to as residency options. Okay, because that could play an important role in ensuring that you're not keeping the data away from where the patients are, because when the patients have legal issues in relation to you giving their data away, or in case of negligence resulting into data breaches, then it means that you'll act within the laws of that country. But if you have the data being stored in another country, then the laws, the legal boundaries may be very difficult to navigate. Okay, so that is very, very key. And then the agreements that I talked about, the ones we are referring to as the business associate agreements, should be in place, outlining clearly what are the obligations of the service provider in relation to data security and privacy issues. Any organization dealing with the healthcare data needs to comply with the authorities in terms of complying with the regulations in place. Okay, these regulations may actually be national regulations, but they can also be regional regulations or continental regulations. So if, for example, we say that South Sudan doesn't have updated laws on data protection, it does not mean that you should behave recklessly because of that. You can be taken to another court. Okay, it could be a regional court that the organization can be sued in. Okay, So compliance is actually very, very important because of these national, regional, and international regulations associated with health data protection. Okay. Let's move to health information systems. With this, we want to look at, let us say, for example, the systems that we have in place in South Sudan currently. We have a system that has been deployed across the country, but of course there are some facilities that are not well equipped with computers and also electricity, so they are still using paper-based health data management. Okay, so looking at the system that we have, the health management information system that we have, the same challenges that happen to cloud computing in the context of health data are the same challenges that will also happen to the health information system. Okay, so issues of unauthorized data access, data breaches, the theft of data, and any other disruptions that can be caused remotely to this system, impairing the service provision, can happen. So it is very important that the appropriate measures are taken, and in this case, authentication protocols have become very important. No, it shouldn't be very easy for people to access this database or these systems, okay, and manipulate the data, either manipulate it or even export it and then use it for their own purposes. Okay, so we are going to look at what needs to be put in place for such systems. So the authentication part is basically ensuring that the right person has the access to the data. You don't want anyone to open the computer and access it. Okay, so the traditional authentication methods, the password and the username, and then the security question, and then the token. These are what we call the traditional authentication methods. Okay, it's just like your phone or your laptop. You want to make sure that someone who opens your laptop should have the password and the username. If they don't have any of those, not even any of them, if they don't have both of them, they don't have the username or the password, they cannot enter. Okay, and then perhaps if they have entered the right password, the right username, then you ask them a security question. They should answer that security question. For example, it could be the last time you went to Mombasa. So you know that date in your head. You know that it was 25th of July. Okay, 2022. Okay, so you have a security question that says, when did I go to Mombasa? Okay, so you have that date in your mind. So that's the security question, and then you put that answer there. So anyone who comes and opens and that person is not you, and they ask that question, they cannot enter because they will not really know that date. That's what you call a security question. And then we move to what you call tokens. So when you have access to this data, you have gone through the first steps, a token will be generated. These are basically digits. These digits, you enter them for you to have access to be able to perform particular task, and also not to be able to access all the data. There is a limitation to which you can access this data, and then also there is a time frame for which you can be accessing this data. So that's the token concept, that a token is like a key to, let us say, a library. So when you get this key, which are basically figures or codes, you can enter the library. That is an electronic library, for example. You can be able to access certain sections of the library, and you may not be able to access other sections of the library. But that access that has been granted to you may not exceed a particular time. Okay, the fact that it does not exceed a particular time is also very important, because you don't want to give someone access and then that access is forever. That time is very important, because they can perform a number of things that can be detrimental. So if you limit the time, if it is, for example, transferring the data to their external device, if the time is limited, then they cannot be able to transfer that data. That's the concept of tokens. So the password, the username, the tokens, the security questions, we call them traditional authentication methods, and they have their own limitations. Okay, it is very easy for attackers to predict multiple times, to predict your username or password until they finally get it. So they have that security vulnerability. Okay, and then sometimes you can have what we are calling single point of failure. If a username or password are compromised, attackers can get access to the whole data. Okay, so you don't want to have that situation. Okay, that's one of the limitations that you will have with the traditional authentication methods. Okay, and then of course not everyone remembers the passwords that they use for different accounts easily. So it is not something that you can easily, like your user experience with the systems that require these passwords may not be the best. Okay, so you can imagine how many passwords you have for every platform or account that you have with different applications. It's not a good way. It's not a good way of keeping your username and password. So that now brings us to what I can call modern authentication protocols, privacy preserving authentication protocols. For them, they address the challenges that are being posed by the traditional authentication methods. So with this, we are looking at what we call multi-factor authentication as one of them, that if you have entered the username and the password, you also need either a fingerprint or a code will be sent to your phone, and then you use it to access the system. Okay, those of you who use Microsoft accounts, when you enter your email, then you enter your password. Sometimes a code will be sent to your email. So you go and get that code and enter it. So that is multiple authentication, such that if someone has your password or username, they cannot do anything with it, because there are other layers of authentication, okay, or other layers of security. Okay, so for example, for your Facebook accounts, you have what you call two-factor authentication. If you enter your username and password into your Facebook account, if you had enabled two-factor authentication, then a code will be sent either by email or by SMS. And then when you're indeed the owner of the account, that means that you have the phone, and that SMS will be on your phone, and you need to enter it for you to access your Facebook account. That is two-factor authentication. Okay, so there are also other apps, okay, mobile applications that also provide this layer of support or of security, such that guessing your username and password is not the gateway, the only gateway or gate pass for someone to penetrate your data. And then we have what you call public key cryptography. With this, you have we have keys, which are basically codes. There are codes that are public and those that are private. The extent to which you can access data using these keys is dependent on the nature of the key that you have. When you have a private key, it means that you have the ability to decrypt data that the public keys cannot. Okay, so data encrypted with public key can only be decrypted with the corresponding private key. Okay, so that is about the keys that are generated that can be used to access data. Okay, and they should be kept private, especially the private keys. Okay, it's just like having keys to a lock. Okay, you can have a key that can open, but it cannot close. Okay, so it's the same concept with the public key and the private key. The private key is more superior because it can lock and it can unlock. That's what we are saying with that. And then biometric authentication, after entering your details, it could be your password, username, security question, and then we go to your face recognition technology, or we go to your fingerprints, or we check your eye, the iris, we scan it. Okay, that is biometric authentication. So you can see that these methods are more advanced. The layers of security are quite advanced, and there are quite many. So in our conversations, we have emphasized that data should be kept securely, meaning that you need to implement the strategies of having multiple layers of security to do with password, to do with usernames, to do with the biometric authentication, to do with the having keys, encryption keys, and a lot of other things. So it is very, very, very important that these are actually implemented to make sure that data is kept securely. Okay. Other strategies can include what we call firewalls. For example, if you have, let me use an example of a website. If you have a website and that website is hosted, regardless of where it is hosted, but that website is used by people within South Sudan, if you have other people visiting the website and they are not from South Sudan, then you block them off. That's what we basically term as the firewall. Okay, that's what we term as the firewall. You want to control people who enter into a network. Okay, because some of the attackers are not actually within South Sudan, they're actually in other countries. Okay, so it's basically like saying that in my home, I don't allow strangers. I allow people within the community that I know. That's what firewall is all about. That you don't want to have incoming traffic into a network and you don't have control over. And then we have intrusion detection systems. Okay, there should be an systems that can detect or that can alarm when there is suspicious activity around the data. Okay, maybe it could be multiple entry of, or someone trying to enter their username and password several times. There should be an alert being sent using these intrusion detection systems to notify administrators that there is a threat here. Okay, so we have looked at cloud computing. We have looked at our our health management information systems and what we need to do about them. Now we are looking at the third aspect, which is medical image analysis. This is a neglected area, I could say. When patients come to the hospital, X-rays are taken. They could be CT scans, they could be MRI, ultrasound, mammographs, all those. These tests are of course very important because they allow us to visualize the internal organs of the patient and come up with a good diagnosis, and therefore a good care plan, and therefore good patient outcomes. Now, this imaging carries a risk. Privacy issues can arise because this imaging comes with patient identification information, and they can reveal sensitive details about the patient. Okay, there could be birthmarks, excuse me, there could be facial features, there could be tattoos, and if you have a collection of these imagings and then share it perhaps with the it could be researchers, collaborators, whatever they are, that's an issue where these images that have patient particulars can land into hands of individuals that have not had the authorized or the consent from the patient. The patient does not actually know that their X-ray is being accessed by other people that that he did not consent to have access to this imaging. So you don't want to breach that privacy about the patient. And if the patient really realizes that he used their X-ray film without their consent with the other third parties for whatever reason, it can result into legal suits. You can be taken to court. Okay? But of course, like the previous discussion where we said that there is a delicate balance always with these matters. You want to produce research, but you cannot produce research if you keep the data sealed. You're not using it. You do research on data that is available. Okay, so you need to, there's always that balance. If you're going to share this imaging information with, for example, collaborators or researchers, then there are steps that you should take, either getting consent, okay, or removing identifying information from these imaging files. So that is what we call de-identification techniques, ways of removing identifying information from medical images. Okay, so what do you do? We have what you call pixelization. With this, we basically, you blur the patient information. Blurring is basically saying that you make the information not to appear. It is not readable. That the patient identification information is not, you cannot recognize it. So it removes the fine details for it to be read. Okay, so pixelation is when you blur patient information to make sure that it is not easily seen. And then we have what we call masking. Okay, you have seen images where the face of the patient is actually covered. The face of the patient is covered. Let us say they have a neck swelling, and then you take the picture of this patient, of course with consent, and then before you share it, you make sure that you cover the face of this patient. So you mask it such that their identity is not revealed. And then you can use generative adversarial networks. This is a technology that allows you to create synthetic medical images that preserve diagnostic value while protecting privacy. You could be interested in using, for example, the image for, let us say, educational training purposes. You can use these generative technologies to be able to generate an image that you can use for that purpose. And when you do that, you're basically not infringing on anyone's privacy. That's what we are saying there. Okay? And then we have also mathematical techniques that can analyze images without needing the full image reconstruction. This is basically to say that there are a lot of emerging technologies that can be used to reconstruct images. Okay? Reconstruct images and use them for the purpose that you actually want to use them for. Okay? So this is the aspect that we have talked about, balancing. You want to collaborate, you want to do research, you want to improve patient outcome, but you cannot do that without using patient information. So usually you need to follow the right procedures or protocols if you are to share this information with another organization or with another professional. Okay, so that is very, very key. So we go to the fourth category. I hope you're following very well. Is there a hand? Is someone raising up a hand? Are we on the same page?
Yes. Yes.
Okay, good. So the other category where we get health data, what you call the digital devices. Here we are calling them health devices. You can call them mobile health devices. It's okay to call them that. But basically what you need to note is that a patient can have a phone that can take their pulse. Okay? They can have an app on their phone that can take vital signs, for example. It can be a wrist watch. It can be a band that has sensors that they can put on their body, and then a parameter is determined. It can be a glucometer that you give the patient, and then when they're at home, they check their blood glucose levels. And since it is a digital glucometer, maybe it is connected to the hospital, so the patient does not need to manually send the results of their blood pressure, their blood glucose, to you. The moment that reading is taken, you can see it. You can see those readings on your system too. The concept of Internet of Things, where you have devices being connected to one another through networks. Okay, so you can still have that glucometer connected to devices within the hospital, and therefore the readings, when they are taken, you can be able to see it in real time. So that is also data. Okay, still the challenges are the same: data security and privacy issues. So how do we navigate around that? Issues of data encryption, we already looked at that, said that the data should be in a format that cannot be read even during transmission, because it can be intercepted and it is decrypted. Okay, and then who who has access to these mobile devices, okay, and what is the nature of this access, okay, because you can have access and be able to do manipulations, operations with this data. So when you're looking at devices that you're going to give to patients, look at the levels of authorizations that are available, who can manage what, who accesses what, okay, and then the ability to share data, okay, what data is shared with other third parties. So you can have an application that is installed on, let us say, mobile device that the patient is using for their health, but there are multiple companies involved in such a device. So what are the parties involved, and what are their data protection and privacy policies or reputation? And then being able to conduct independent security audits, okay, that is also something very, very key. So let's look at the privacy enhancing technologies. Some of it, the things that we are going to talk about are already things that we have discussed. We all at least have ideas about issues to do with the encryption, issues to do with the with authentication. Okay, so these are some of the things that we are going to talk about under these slides that are going to follow. So basically, when we talk about privacy enhancing technologies, we are talking about the technologies that can be used to protect this health data. Okay, so let's look at the first one, which is homomorphic. I'm not pronouncing it very well, I don't know why. Homomorphic encryption. Homomorphic encryption. So what does this really mean? Is that you remember the other concept that you want people to continue being able to do their research on data such that new innovations can come in. But when you give them access to this data, you may not really know what they are going to do with it. Okay? And you don't want them to get particular details of patients. Okay? So what this one does, homomorphic encryption, what it does is that it allows you access to this data, but the identifying information about patients is what you are not going to have access to. I hope that is very clear. You can analyze this encrypted data, but you cannot see the underlying patient information. Okay? So that is one. So you can do whatever research or analysis that you want with this data, but you cannot see the underlying patient information in its original form. And then the second approach is what we call pseudo-anonymization. Pseudonymization. Initially I added the anonymization. The A is not there. Okay? Pseudo is false. Pseudo means false. And then anonymity or anonymization means without identifying information. Okay? So with this, basically the meaning comes out that you don't want to have patient information on the data or in the data, but you identify them with the what we call pseudonyms, which are not the real patient information names or identifiers. Okay, so if for example the patient is let's say it is Dan, then that Dan name is not used, but that person is given another name. Let us say Mose. So Mose is a pseudonym. It's not the real person's name. So those technologies are available. Okay, so you can have access to this data, but you really know that the names are not the right names. They are not the right identifiers. And then we have federated learning, which is basically that you can perform analysis on data, on health data, without having to collect that data or sending it to a central unit or a central server. So you can do whatever operations that you want when this data is distributed, what we are calling distributed data sets. Distributed data sets. So for example, you want to collect, you want to run operations through, let us say, machine learning models, where you're training computer systems on large sums of data to generate patterns and make predictions, for example. But you don't want to send all that data from the different areas to one server. So you keep, if for example the data is in Kajokeji, it remains there. In Yei, it remains there. The one in Juba remains there. But you can perform your operations on all these data sets from where they are. Okay? When you do that, it means that you are not, if you bring this data together, you're actually increasing the risk. Okay? But if these data sets are where they are, the risk is actually minimal. Okay? So this improves data privacy. It's just like saying you don't want to collect, you don't want to put all your eggs in one basket. That is what it means. In your transfer of these data sets from wherever they are, that is where data breaches can happen. Okay? So you don't want to mix up this data on a central server. Having distributed servers is what is actually important. And then the last one in this, under this, is what you call secure multiple party computation. With this technology, it's just like saying, let me give you access to my data. Okay, you have your two organizations. You want to look at the data from each one. Or organization A wants to look at data from organization B, and organization B wants to look at data from organization A. So, of course, you don't want to reveal all your data to whatever organization that you're probably in the same field. So what you can do is to use this technique, the secure multiple party computation, which to allow you, the parties, to compute a function on this data without getting the details on individual data to one another. I hope I'm very clear here. So each of these organizations can look at data from one another, that you cannot see the details of this data, but at least you can perform whatever you want to perform. You can perform or compute those functions that you have agreed upon. Okay, so that leaves you without knowing the competitive advantage of either organization. So that is what we call secure multi-party computation. Okay, these are the same things that we have talked about. The last aspect that we can talk about is personalized medicine. This is where the world is going. You don't want to treat people with the same approach, yet they are not actually the same. No, you cannot have two individuals reacting the same way to the same medication, having the same side effects, responding in the similar circumstances. Why is this so? We believe that genetics plays an important role in how people respond to therapies. So if we are to know your genetic makeup, if we are to collect your biodata, then we can be able to know or predict even the kind of conditions that you are likely to get, and even address them before they happen. And also, if they happen, we are able to know what we can use to treat you. That's what we call personalized medicine. You can call it individualized medicine. So the key aspect is you have to collect a lot of information about this person for you to be able to know or predict how they can respond to certain treatments. And this obviously creates issues to do with data security. Okay, so you get all this data and then be able to use it to be able to plan for their medical care appropriately. So the last bit is when it happens, what do you do? When you have a data breach, what do? You have to arrest the situation, which we are calling containment here. After containing the situation, that means that there is no more unauthorized access to this data. Then you assess the extent of the damage. How far did they reach in accessing this data? And then 3, you can communicate to the patients and the authorities about this data breach that has happened. Okay, it is part of the requirement for you to communicate to the authorities that there has been unauthorized access to this data, or data has been stolen. Whatever it is, you need to communicate. And then put strategies to patch up the holes, what we call the vulnerabilities. And then lastly, keep checking. Okay, keep checking the systems. Do those checks to make sure that the vulnerabilities do not happen again. Okay, so that marks the end of the presentation on data security.